Okay, so as a group, we reviewed the group that was doing Cairo, Egypt. Their two main health problems included air pollution and hepatitis C. They included a primary and secondary prevention when it came to air pollution, with public awareness about preventing respiratory disease, including masking during high smog days and using apps to be aware of the smog level. And they also did secondary prevention of screening for respiratory diseases. Their tertiary prevention plan included expanding home health when it came to treatment of chronic diseases, including COPD and asthma that occurs in response to air pollution. For hepatitis C, they want to expand Cairo's already very robust mobile screening clinics and provide screening, early screening for cirrhosis before they have any symptoms. So that was their interventions, and these are our response to it.
So the question that I really focused on was, were the implementations for intervention feasible for the community, and why or why not? So from the podcast, we learned that Cairo's already working on an air quality management plan. And it's going to include things like better monitoring, stricter emission rules, and public awareness campaigns. So they already have that in place, which made their interventions of community education and mobile screening seem pretty feasible to me, based on what's already happening, so they don't have to start from scratch or anything. And I feel like that could be implemented sooner rather than later. And as far as the resources, ideas, and stuff, they talked about school programs, digital pamphlets, mask wearing, and then promoting walking or biking as opposed to driving and everyone using their own personal vehicle just to cut down on emissions. And then they also mentioned things like mobile clinics or setting up at schools and having different transportation hubs, just to cut down on construction and things like that would cause more pollution to the air. So their plan covered primary, secondary, and tertiary prevention. They talked about all of the different ways that they would raise awareness and then move on to screenings, and then later they talked about how they could help people manage their chronic illnesses. And it seemed pretty achievable to me, and it seemed like something that the people in Cairo already kind of had started working on, so it all seemed like it should work.
So, if I were a community health nurse and a pandemic or communicable disease occurred in Cairo, Egypt, a city with a high population density of 19,000 people per square kilometer, it would be essential to implement several public health strategies to prevent disease transmission. As a community health nurse, I would focus on widening access to health care through mobile clinics and digital health records, which can help under-reserved or can reach underserved populations and improve care coordination. Public awareness would be a key component using mass media campaigns, as was mentioned in the podcast, to educate the community on prevention strategies, symptoms to watch for, and the importance of vaccination and screening, especially for respiratory illnesses and diseases like hepatitis C. Reducing pollution would also be crucial, as car exhaust and burning emissions contribute to chronic respiratory issues. Could also advocate for air quality management plans supported by laws and community campaigns. Promoting carpooling, cycling, and walking could also reduce air pollution and encourage healthier habits. Lastly, partnering with local universities and organizations would help empower the population through education and outreach. Nurse-led community advocacy would play a vital role in supporting health policy changes that address both the environmental and social factors that affect health outcomes.
So I answered the question about how to evaluate the effectiveness of the proposed intervention. I did the intervention that they proposed about mobile respiratory screening clinics. I would probably start by looking at how many people actually show up to get screened, especially in the areas with high pollution and health risk. That alone would tell me if the community is interested and if the outreach is working. Next, I'd want to know how many of the screenings led to early diagnosis, like if we're catching cases of asthma, COPD, or other breathing issues before they get worse. I'd also follow up on whether those individuals were able to get the care or treatment they needed after the screening. Another thing I'd pay attention to is if these screenings help reduce ER visits or hospital stays for things like asthma attacks. That would show we're not just identifying problems early, we're also helping people manage them better. Lastly, I'd ask for feedback from the community. If people feel like the clinics are helpful and easy to access, that's a big win. It would mean we're building trust and actually making a difference with something as simple as bringing healthcare to them.
I think the current plan does a good job of focusing on follow-up care and monitoring, but there are definitely a few ways it could be strengthened, especially when it comes to pharmacological support. First, I'd recommend expanding access to a wider variety of hepatitis C medications, especially the newer direct-acting antivirals. Not every patient responds the same to treatment, and some might have other health issues like kidney disease or cirrhosis that make certain medications less ideal. By offering more options, like Epclusa or maybe even Mavorite, providers can tailor treatment to each patient's needs and improve long-term outcomes. These DAAs are also fewer side effects and shorter treatment durations, which help with adherence. Speaking of adherence, another change I'd recommend is building in medication support systems. Things like nurse check-ins, digital reminders, or even simple tools like pill organizers can make a huge difference in making sure patients stick to their treatment plan, especially in communities where access to follow-up appointments might be limited. Lastly, I think it would be helpful to combine medical follow-up with psychosocial support, like counseling or support groups. That way it helps reduce the stigma and helps patients manage the emotional side of living with a chronic condition. This would give a more holistic approach to tertiary care rather than just focusing on lab values and checkups. So overall, by expanding medication options, adding adherence tools, and supporting patients emotionally, the tertiary plan would feel more well-rounded and realistic, especially in a large, high-risk community like Cairo.
Okay, so the final question in my response is identifying 2 key challenges a community health nurse might face in providing care in this community during a pandemic. One big challenge as a community health nurse would be how crowded the city is. Some areas have more than 19,000 people per square kilometer. It's a lot of people packed into a small space. It'd be super hard to get people to socially distance or isolate if needed, especially in lower income areas where housing is tight and public spaces are shared, including if they have multi-generational housing. That kind of density would make it really easy for an illness to spread quickly, which puts even more pressure on nurses trying to control the outbreak. Another challenge would be making sure people are actually getting accurate health information. The podcast mentioned how there's already a need for more public education when it comes to things like air pollution, hepatitis C. So during a pandemic, that gap would get even worse. Nurses would have to find ways to get reliable info out to a huge population, and that's not always easy, especially in places where not everyone has internet or trusts the healthcare system, such as heavily rural areas. I had to get creative with outreach, maybe using local leaders like religious leaders or religious institutions to spread the word.